Namaste, friends. A very warm welcome to you all. My name is Satish Thakur, current chair of Canada India Foundation, and we have Ritesh Malik, our national convener, and Dr. Harish Verma, president of Canadian Ayurvedic Practitioners Association, with us this morning. We are gathered here to celebrate a very special occasion today, World's Ayurveda Day. Ayurveda, as we all know, over 6,000-year-old Indian tradition, which focuses not only on physical, but also the mental and spiritual health. It is a holistic science targeted to overall well-being of a life journey. We are in a festive season, just celebrated one of the most cherished festival of lights, Diwali. And today being the final of these festivities, as we are celebrating a bond between siblings named as Bhaiya Dooj, a very happy Bhaiya Dooj to you all. And friends, as you perhaps know, bringing the benefits of Ayurveda and getting it recognized as an alternate system of medicine in Canada is one of the key goals of CIF. And the past year and a half, we have hosted over 24 Ayurvedic practitioners from across the world on the CIF Ayurveda Speaker Series platform. And they have contributed immensely to the promotion and better understanding of this most ancient of all medical systems. We are focusing now in creating an ecosystem of leading some key initiatives to find evidence-based data that would cement the claim of Ayurveda in the modern context. In this regard, we are extremely fortunate to find an ideal partner in University Health Network, Toronto, one of the world's top teaching and research hospital group. CIF, along with UHN, has launched a $1 million research fund exclusively to explore the benefits of combining modern medicine with the ancient systems like Ayurveda. Dr. Paul O, Medical Director, UHN, who is one of the speakers today also, is an enthusiastic voice in our efforts in developing and integrating medicine approach to find cures of the metabolic illnesses which affect the South Asian population disproportionately. Ms. Nilofer Delami, a nutritionist and a specialist in the cancer education from UHN, is also with us today to share her thoughts. We are very fortunate to have our panel of eminent practitioners who are leading the effort, especially with the Government of India, Ministry of Ayush, so to spread the message of Ayurveda to the world. A very, very warm welcome to Dr. Manoj Nisariji, Special Advisor to Ministry of Ayush, and Dr. Tanuja Nisariji, Director of All India Institute of Ayurveda, along with her colleagues from All India Institute of Ayurveda, Dr. Pramod Yadav and Dr. Prashanth Dharmarajan. We are looking forward to a very engaging discussion today, and our constant source of inspiration in this journey, of course, our own Consul General of India in Toronto, Ms. Apurva Srivastava-ji, a great supporter of our initiative. Thank you all for joining this morning. And we at CIF hope that today's discussion and one to follow will help inform the Canadian public and policymakers on the inherent benefits of adopting a holistic system that stresses on prevention. Inherent in strategy are better health outcomes as well as tremendous cost savings. And we are looking forward to this exciting session. Before we begin, let me invite Ritesh Malik, our national convener, to introduce our special guest of this morning. Ritesh, over to you.
Thank you, Satish ji. Namaste, everyone. Our guest today, Apurva Srivastava ji, she's our CG here in Toronto. She doesn't need any introduction here, but for benefit of everyone who's joined us from all over the place, Mrs. Srivastava is a career diplomat, having joined the Indian Foreign Services in 2001. Prior to being appointed as India's Consul General in Toronto, she worked with the Minister of External Affairs from January 2017 to August 2019. In her 19-year diplomatic career, she has served twice in the Indian Embassy in Paris from August 2003 to October 2006, and again from August 2012 to July 2015, and in the Indian Embassy in Kathmandu from June 2009 to August 2012. In the headquarters, she has served as Under Secretary SAR and as Director Administration. We are really fortunate to have her here in Toronto. She has been serving the community with a lot of passion, and some really path-breaking initiatives are being spearheaded by her, Ayurveda being one of them. Whatever we have achieved here in Canada in Ayurveda would have not been possible without her vision and continued guidance. Welcome, and over to you, ma'am.
Thank you, Ritesh. My God, such a great introduction. Thank you so much. A very good morning to those joining us from Canada, and a very good evening to those from India. Thank you, Canada India Foundation, for for promoting Ayurveda, for organizing these series of sessions, and today's session on integrating approach and management of metabolic syndrome on this auspicious occasion of 6th World Ayurveda Day. This theme really syncs well with the recent initiative of Ministry of Ayush for promotion of Ayurveda for Poshan. We are what we eat. We somehow we get swayed away by this current food habits of following various diets. But now again, there's a growing realization back in India that our food which we kind of were leaving behind are the real superfoods, and that is what it's based on the climatic condition, our body, our ancestors have created that food habits based on various factors, and now we are realizing it. So I think it's a great theme for the Poshan is a great theme for this year. I believe today's session will give us a better understanding of the role of correct nutrition in promoting overall health of humankind. I also want to thank the Canadian Ayurvedic Practitioners Association and Vedic Spiritual Heritage Foundation for supporting this great initiative. My special thanks to Dr. Manoj Nesari, Advisor, Ministry of Ayush. You have led us from the beginning and every step of the way. So thank you so much for your guidance and your help. Dr. Tanuja Nesari from All India Institute of Ayurveda. You have been a great supporter, madam. Dr. Paul O of University Health Network. UHN has been a great partner for all of us, not only in Ayurveda, but in general in our health related initiatives. So thank you so much, Dr. Paulo, for your sustained support. I also want to welcome Ms. Nilofer Delami of Princess Margaret Cancer Center. Really look forward to hearing on your views on how do we move toward integrative medicines, deriving the benefits of Ayurveda, which has been developed over last 6,000 years. In recent years, we have come to realize the efficacy of Ayurveda in treating various ailments across the world, and we have a very strong reason to believe that Ayurveda is getting more and more popular here in Canada. We have 1.6 million Indian diaspora, 700,000 Indian citizens living here, 230,000 students studying here, and we all all these Indian origin people and the Indian citizens realize the importance of Ayurveda. So we don't need to teach them. We have organizations like Canada India Foundation, Canadian Ayurvedic practitioners to create awareness among the Canadians at large. I have been in Canada for over 2 years now, and I'm really amazed to see that supermarkets are filled with vitamin dosages having turmeric as the main ingredients. Cafe menus having turmeric latte as the options. There's also a wide-scale public embrace of yoga in Canada. 1 in every 5 Canadians practice yoga, and it would certainly be interested to try healing paths of Ayurveda. As yoga and Ayurveda are complementary to each other, and the practice of yoga can increase the beneficial effects of Ayurveda, a combination of yoga and Ayurveda can go along a great way to giving good health and preventing diseases. And lastly, the immunity boosting qualities of Ayurveda has come into focus during the current pandemic, and this has been heartening to see the people recognize the great benefits of old medical system of Ayurveda. So as far as today's session is concerned, I'm here to learn. We have such an eminent panel of speakers. I would rather listen to these experts present and try to understand the complex cluster of ailments that are associated with metabolic syndromes and what Ayurveda has to offer to mitigate and cure such conditions. I'm sure that the insights and recommendation of our experts will help in creating more awareness about the efficacy of Ayurveda. I thank you all for being present here and sharing your valuable insights. I look forward for the wonderful session. Thank you.
Thank you, Apurva ji. Thank you so very much. You've been such a strong pillar in this whole initiative. And we at CIF have been really fortunate to have been working with you, with your enthusiasm and with your guidance. We've come where we are today. And there are a few other people who've been really helpful right from the word go, right from day one. Dr. Manoj Nisari being one of those people. And I would like to invite Dr. Manoj Nisari to actually give his remarks today on this important session. Dr. Manoj Nisari ji is an advisor in the Ministry of Ayush, Government of India. Dr. Nisari has over 20 years experience in Ayurveda clinician. He has developed expertise in Ayurvedic management of pain-dominant conditions, particularly spinal degenerative diseases. His contribution towards development of Ayush sector has been varied in areas such as policy and planning for matters pertaining to Ayurveda education, practices and research, capacity building of stakeholders, development of new courses, regulations, research plans, various schemes for promoting different sectors in Ayush. We at CIF have had the privilege and honor to meet him in person few times, and every time I have come back more committed towards how we can make Ayurveda part of every household for better health and overall well-being. Sir, we look forward to hearing from you today on this event. Thanks.
Thank you, Ritesh ji, for this wonderful introduction. I am really thankful to the Canada India Foundation, Satish Thakkar ji, Praveen Chankotra ji, Dr. Harish Verma ji, and all from the Canada India Foundation, as well as from the UHN, Dr. Paul O, and the Consulate General of India at Canada, Ms. Apurva Srivastava, for taking this initiative and bridging between the Canada India Foundation, UHN, and the All India Institute of Ayurveda. I'm also thankful to Professor Tanuja Nesri, the director of the All India Institute, and the entire faculty, and today's speakers, Pramod Yadav and Dr. Dharmarajan, Prashanth Dharmarajan, for making the presentation over here, and they will explain about the various aspects of Ayurveda. A few things regarding this Ayurveda day. I would like to explain that for this 6th Ayurveda day, the Ministry of Ayush, Government of India, had chosen the theme as Ayurveda for Nutrition, and this theme particularly we have chosen with the aim of achieving and helping all the countries achieving the Sustainable Development Goal number 2 and the Sustainable Development Goal number 3 of the UN, which has been adopted by all the nations. The Sustainable Development Goal number 2 is the nutrition for all, and it is the zero hunger. At the same time, the Sustainable Development Goal number 3, there are various aspects, and primarily it is for the health and wellness. So when we talk about the health and wellness and the nutrition, the first and most important factor is the proper nutrition, the proper diet, which is very much important because Ayurveda as well as the WHO, so both now they have focused on the promotion of health and the prevention of the diseases. And when we are talking about the promotion of health, the tripod of the health, which is described by Ayurveda, in that the diet is the first one, the second is the sleep, and third is the brahmacharya or the creativity. So this is the tripod for the entire health and how actually we can promote the health. And since actually the diet is the first one, so we actually focus this on the nutrition, and this is applicable to the entire world in countries like India or the Asian countries, and in the African countries. Many of them, they are suffering with the malnutrition, that is the undernutrition, whereas in the Western countries, especially the USA and the Europe and Canada and many other countries, the malnutrition is presented in the form of overnutrition. So undernutrition as well as the overnutrition, both are equally detrimental, and especially when we are talking about the overnutrition, that leads to the metabolic syndrome. And that's why I'm thankful to, and I really appreciate the theme chosen for today, the metabolic syndrome, which is very much relevant to the western part, or especially the northern part of the Americas, the Canada and the USA. And this malnutrition, how actually is leading to the various non-communicable diseases, that is the metabolic syndrome, and it includes the diabetes mellitus, the hypertension, cardiovascular diseases, as well as many type of cancers. I would like to inform that since last 6 years, means even before the WHO had adopted this slogan and the disease burden, the Ministry of Ayush, Government of India, we started the integration of Ayurveda and Yoga on a very large scale in the public health program in the NPCDCS, that is the Prevention and Control of Non-Communicable Diseases. And this program we started, we launched, and we developed the guidelines for this, that how actually it is to be launched, and in three major districts in each state. So we started implementing this. And when we implemented this program, and in which the millions of people, they were actually screened, and those who were actually found pre-diabetic or diabetic, the intervention was given to them. And there actually we observed that all those who were borderline or the pre-diabetic, so their pathology, it could be stopped, the diabetes could be reversed, the diabetes mellitus could be reversed, and their parameters, they become normal. At the same time, those who were diabetic on many medications, so in that the HbA1c could be well controlled, and because of that, the number of medicines they required, so that could be reduced. So that was another outcome. And the third thing is that their quality of life is really good now. In this context, I would also like to mention that in the year 2005, the Government of India launched a mega program on the diabetes, a research program under the Nimitli research, that is a new millennium initiative. And in this, the intervention which was selected from the Ayurveda was the combination of turmeric and the Indian gooseberry called as Amla. And the important aspect is that the Amla and this turmeric, when actually it is given together, and especially while going to bed, at the chromosomal level, we found that it prevents the chromosomal damage which is ongoing in the diabetic patients. So despite the sugar level could be normal, HbA1c could be normal, but still the pathology, it goes on, and because of that there was chromosomal damage. But those who were on this particular diet, so the chromosomal damage, it was prevented. So in another word, we can say that with the intervention of Ayurveda, it is possible to prevent the target organ damage like the retinopathy or the renal failure or the angiopathy. So this could be prevented. So there are many opportunities are there, how actually we can collaborate on these aspects, and how we can undertake the various research programs. What the Canada India Foundation, they have already launched the joint program for this research, the fund. So that is possible. And from the nutrition point of view, just few lines I would like to mention that the Indian diet, or rather I would say that the diet which has been prescribed by the Ayurveda in the ancient text, it is the most scientific diet, because the pathology, when especially in the metabolic syndrome, it is the pathology of the more inflammation. There is a lot of liquids, there are a lot of fluids which are there in the every tissue, and this the pathogenesis, in Ayurvedic language, it is called as kledh. So the Ayurvedic diet, like the barley or the various kind of millets and many more things, so or the green grams, so they basically improve the metabolism, and without any medicines, it is possible to control this diabetes. I am really thankful to the UN and the Honorable Prime Minister of India, because the Honorable Prime Minister, he actually proposed the to follow or to observe the year 2023 as the millet year, and the UN has now agreed to observe the year 2023 as the millet year. And these millets, there are numerous millets which are being actually practiced and in the daily diet, not only in India, but all over the world. And the millets, they contain a lot of nutrition, they contain the micronutrients, which are very essential to control all this metabolic syndrome. And I'm sure that with these various initiatives, the world will be able to control the rising burden of the metabolic syndrome. So with this, I'm really thankful for the Canada India Foundation and the UHN for taking this initiative, for organizing this event on the occasion of the 6th Ayurveda Day with the theme Ayurveda for Nutrition. And throughout the year, we'll keep on working on this particular theme to bring out the more and more various aspects of this, the Ayurveda part of the nutrition. Thank you very much.
Thank you, Dr. Manoj ji. We also have Dr. Tanuja Manoj Nisari ji, who is better half of Dr. Manoj Nisari, and together they make Ayurveda powerhouse at their own home. Dr. Tanuja Manoj Nisari ji is working as director at All India Institute of Ayurveda, New Delhi. She's associated with several academic, health, and government institutions in different capacities. She has over 29 years of experience of teaching in Dravya Gun and Ras Shastra and research. She has guided over 20 PhD scholars. Dr. Nisari is an acclaimed international speaker on Ayurveda and has organized series of national and international seminars, workshops, CME programs, and medicinal plants exhibitions on thrust areas of Ayurveda. I recently attended the concluded event in Delhi on International Ayurveda Day, which was a real testimony of her hard work and long-term commitment to Ayurveda, well attended by Ayurveda policymakers, industry, experts, and many students as well. She has published 74 original papers and has authored, edited 15 books on Ayurveda. Thank you, ma'am, for participating today, and we really look forward to hearing from you. Thank you.
Thank you very much. Now, thank you very much, everyone. And now I am on the driving seat. And it's a great introduction. Thank you very much, Ritesh ji, Canada India Foundation, Satish Thakkar ji, Harish Verma ji, Dr. Paul O, Medical Director, UHN, Ritesh Malik ji, National Convener, Consulate General Apurva Srivastav ji, Nilofer, and my colleague from All India Institute of Ayurveda, Dr. Pramod, Dr. Prashanth, and advisor, Dr. Manoj Nisari. It's a great honor and the opportunity to be in this very, what we can say, the historical and the landmark event, and which is, we are here to celebrate Ayurveda Day, 6th Ayurveda Day, with the theme Ayurveda for the Poshan. And I'm really thankful that in many events what we have organized during last 1 week is for the Ayurveda for nutrition, Poshan. And here we are discussing about what is the treatment for the excess and how do we make it as a less. It's a metabolic syndrome. So again, it's a great, what the concept note says, that every 4 person in the Canada has a metabolic syndrome and is really looking for the holistic way of the management and how just to minimize the complication and to improve the quality of life. So my colleagues, Dr. Prashanth and Dr. Pramod, they will do the justice about the concept area and practices and what are the practice-based evidence and what is the evidence-based practice in the metabolic syndrome. As an All India Institute of Ayurveda under Ministry of Ayush, I would like to mention here that we are a tertiary care hospital where we have this specialized unit. It is not only the OPD or IPL, it is a unit of the management of the specialized focus area where we have the one special units on diabetes mellitus and this metabolic syndrome and the lifestyle diseases. And so far since 2017, where Honorable Prime Minister dedicated this state-of-art institute to the nation, we have treated holistically and with the integrated approach. We have the database of 14,000 patients of the metabolic syndrome, and also including diabetes mellitus, obesity, hypertension, all these cascade and decentral obesity. So what we have done is, it's the holistic approach, which includes diet, lifestyle, counseling, panchakarma, biopurification, oral medication, rasayanas, immunomodulators, and the counseling, yoga, diet, everything together. And pre and post, all these outcome measures, including lipids, triglycerides, HbA1c, all the markers, inflammatory and every markers, the records have been maintained. We have HMIS. So the database tells about what are the success stories and what is to be done. And what more important is everything is in the mind. So the patient needs to be convinced, so the sustainable result, because basically patient has to decide. The participation of the patient is very, very important in the entire process of this healing and the management. As we say that the Ayurveda is a science of illness to wellness, but it leads to the happiness. And metabolic syndrome, what we have understood, in many conditions, it starts from the depression, stress, and that leads to the bulimia, and many other cascades also start. So we also have mental, spiritual, physical, all held together consider, and the integrated approach, because we have the medical specialist as a co-location, the well-equipped laboratories also at All India Institute of Ayurveda. And now coming and many more researches at postgraduate level, MD, PhD, intramural and extramural researches have been conducted on the black box design, like what is the holistic effect, or one and one, what are the efficacy of the herbal medication like turmeric, triphala, musta, shilajit, avla, and many others in the management of the same, and the herbomineral formulations like Arogyavardhini and many others. My colleague will share the details about that. And that also we are doing. The publication is there, but we have, through our holistic management unit, we have conducted national level consensus and the consultation process workshops and seminar, where a standard treatment protocol that had been developed, and we are practicing a standard treatment protocol which has a clear-cut algorithm for intervention, what sort of the intervention of the Ayurveda and the integration is to be given in a particular condition. When triglycerides are more, what intervention is to be given? When HDL is low and LDL is more, what are the interventions? So that algorithm is ready with us, and that's what we are practicing. And just I would like to say, it is not only one medicine, but it is the holistic integrated approach that is the way forward in the management of the metabolic syndrome. And now, just in 1 minute, I would like to brief all the esteemed audience here who are witnessing this historical event, is that Ayurvedic concept of the management and principal theory. So the first principle is we are a part of the universe. Like human being is also a miniature creature of the universe within himself. And the entire universe is made up of 5 elements: Prithvi, Aap, Tej, Ayu, that is earth, water, air, fire. And why I'm telling this? Because 2 elements are responsible for anabolic effect, and the 3 elements are responsible for the catabolic effect. So 1 is responsible for excess and other 3 are responsible for the less. Going to the universe, and when we try to balance our circadian rhythm and the biological clock with the universal clock, so the health is an outcome of the setting and adjusting the seasonal regimen, environmental rhythm with our internal clock. And when excess is more, if earth and water, the excess is more, and we also consume the excess, that results into the disorder which is caused by the excess. We call it as a anabolic disorder, Santarpanotha Vyadhi, the disease which is excess. Metabolic syndrome is a disease of excess. So the second principle is similar increases similar and decreases dissimilar. That means treatment of the excess is less. So if the metabolic syndrome is a treatment of excess, anabolic, then we have to use all these herbs, medicament management, which leads to the journey of excess to the less. So that is santarpanotta to apatarpano. So whatever the measures what we do, starting from body polishing, that is udvardhana, with the triphala and many other the scraping and body polishing measures, that is also leads to the mobilization of the subdermal fat. That is the one of the important measure of dinacharya, that is daily regimen. I think almost everyone, 99.99% of the population, we have forgotten that. Only in the spa we do sometimes once in a blue moon, but that is very, very important to do. Massage of the oil and followed by the body polishing. Because these are simple measures, but we are measuring their scientific evidence, what happens, what is the mechanism behind doing the polishing, body polishing. Though these are the simple Ayurveda measures, but that really gives us the very, very good results. So that is in the daily regimen. The simple measure as a using, because we call it as a lekhana, treatment of excess is a langhana, lekhana and rukshana. So reducing, scraping and polishing. It is sort of a different treatment modalities what we do. So the simple langhana and lekhana procedure is drinking warm water continuously and medicated water with ginger water, triphala water, or some cinnamon water, cumin water, ajwain water, tulsi water. So that also helps in improving the BMI, basic metabolic rate. That's the Agni Dipana Pachana. And that also leads the journey from excess to less. So these are the simple measures. That's what we advocate in our holistic management. But that also has a scientific relevance and the principle behind why we advocate this scientifically. So these are the simple but very important and effective measures we try to introduce in one's daily regimen, in the diet, which is very, very easy, but the patients really overlook all these things. Then the taking honey water, honey with the water, lemon water. Honey is a best lekhana, langhana. It leads from excess to less. So that's simple, squeezed with the lemon. So these are simple measures what we do and advocate. In the diet, as Dr. Manoj Nesri mentioned about Guru cha apatarpanam sreshtham sthulanam karshanam prati. That means the diet which has high fiber content, but that also stimulates the satiety center very fast. That is a Guru, heavy, that it really gives the feeling of fullness immediately, very in a less time, and also has a simple carbohydrate, low glycemic index. So that is barley. So barley and all the millets, that's what is to be included in the diet, and avoiding all those substances which leads to excess. That is a nutritive value, having high glycemic index like wheat and other. That's what we do. We advocate the vegetables, but since my colleagues will tell the detail, but what I would just advocate only 5 things as a daily herbal health promoter. Everyone with every prakruti and anyone can use. Those are called as a swastha hita, daily herbal health promoter. That is moong, green gram, yav, that's barley, honey, avla, Indian gooseberry, and sandhanamak. So those are some of the things, and rock salt. So these are some of the things if everyone tries to inculcate in their diet, I think that's the way of looking ahead. And Shodhana, biopurification, my friend will explain. Shamana, herbal medication, but the everyday what wear and tear mechanism and free radicals and oxidative stress are generated. That leads to inflammation. So what we really advocate, immunomodulators and antioxidants like triphala, musta, cypress rotundus, turmeric, all these spices, any spices like cumin and others, that also really help in the management, holistic management of metabolic syndrome. In the lifestyle, the vyayama, exercise, yoga, meditation, all these becomes the part of the holistic management. So that's the capsule, that's the standard treatment protocol. My colleague will share the detailed story and how we have developed systematically and also scientifically, because the Ayurveda has the scientific parameters within its own system, and also those can be translated into the conventional medicine, which entire world understands. So there is a science behind, and also the effectiveness is also very important. So at the end of the day, what I would request everyone and what I would pray on behalf of that, on this Diwali, Bhaiya Dooj, and the holy auspicious, that let all be blessed with the good health and free from all these metabolic disorders, and let us the Ayurveda gives us strength in its true spirit, that let everyone be healthy and happy. Thank you one and all for patient listening, and you are most welcome. And we are also eager to join hands for the collaboration with Canada India Foundation and the university also, for the meaningful research, for the academic program, for the faculty exchange program, and for the capacity building program as well. You are most welcome. Thank you. Namaste.
Namaste. Thank you, Madam Nisariji. Thank you for sharing your knowledge and wisdom and your experience with us, and giving some very, very easy to use tips. Actually, we all know the benefits, but I think concising into a capsule form that these are the 5 things you should be doing, it's very, very helpful. Thank you so very much for sharing your wisdom with us. Friends, now we are looking forward to starting a very important discussion. As you all know, that the topic of today is that integrated approach in management of metabolic syndrome. And please allow me to invite first our very dear friend and great enthusiast on this initiative, Dr. Paul O. Dr. Paul O is the Good Life Fitness Chair in Cardiovascular Rehabilitation and Prevention, Medical Director of Cardiovascular Prevention and Rehabilitation Program at Toronto Rehab, a senior scientist at KITE, a leading expert on the role of exercise in rehabilitation. He leads a comprehensive research program that includes investigating best practices in cardiac rehabilitation and analyzing cardiovascular database to better understand the long-term patient outcome. Dr. O, over to you. We're looking forward to your remarks.
Thank you very much, Satish, and a good morning and a good evening to our esteemed colleagues. It's indeed a pleasure to be with you. And as both Dr. Nasaris said, that this is a very auspicious occasion where this may be the first in a long series of wonderful collaborative engagements, both for education and research and hopefully improving the care of those around us. So we're very excited to be with you. We also thought this was a nice opportunity as a symbol of how we might be able to present together with sort of the Western approaches and Eastern Ayurvedic approaches, and ultimately by the end of a session like this, of how we come together and find common ground and complementary ground on how we might move better together. So deliberately, myself and my colleague Nilu Delami will take the approach of here's what we do in Canada right now in terms of approaching metabolic syndrome, and then we'll turn to our colleagues from the All India Institute to present kind of different perspectives, and then hopefully again we come together at this. We recognize that there's a wealth of information all around, and our job is to bring things together for the benefit of the people who might be in front of us. And without belaboring the acknowledgements, I'm also similarly grateful for all of the esteemed guests and panelists for today, and the wonderful support of the Canada India Foundation and the governments of India through the Ministry of Ayush and the All India Institute. So thank you very much for that. Nilu and I will be presenting together, so we'll do a tandem approach on the Western medicine. I'll start a little bit with introductions around metabolic syndrome. I think each of the speakers will be presenting a perspective or an aspect on what they feel is important in the definition or the features of metabolic syndrome. And then I'll turn to Nilu to speak about, what are our common nutritional approaches when we see clients with this cluster of issues. I'll come back and talk about physical activity and integrate some of the Canadian guidelines around risk factor management. And I hope that everyone will see that there are some opportunities for a better integrated approach as we do this as an introduction kind of baseline. Again, I think each speaker will have a slide that might look like this about what is metabolic syndrome. And we've already alluded to kind of abnormalities that cluster around underlying metabolic defects. By definition around the world, we're highlighting these things where glucose levels in the blood may be a little bit high. The balance of cholesterol molecules is off. And in particular, we may not have enough high density, the healthy lipoproteins, and we might have too much of a fatty substance called triglycerides in our bloodstream. We may visibly see metabolic syndrome manifest as a larger waist circumference, and we know that there is kind of global variation on what large really means. In a North American context, this is rather larger than it might be in an Indian context. And also the last element of this is high levels of blood pressure. And I think we all know people who may fulfill some of these criteria. Metabolic syndrome is defined when you have 3 or more of these. It has already been alluded to that in Canada, when one looks for statistics on the frequency of metabolic syndrome, overall, we can see that about 1 in 5 Canadian adults will meet the definition of metabolic syndrome. 3 of those features are around blood pressure and fat and sugar, for instance. And you can also see that the number or the frequency goes up as we age. So this is a very common issue, let alone the number of people that might only be living with 1 or 2 features of metabolic syndrome. This is very, very common. And I think Dr. Ansari alluded to this notion that there is excess in the West. And this is very true if we look at a syndrome like metabolic syndrome in our environment. The pathophysiology is complex, and I know that my colleagues will dive into this in much more detail. The importance of looking at a kind of a figure, a representation like this, is that there is a large interplay between everything that's going on. We recognize that our bodies are not organs in isolation. The things that we eat or the things that we do not affect a single part of our body, but rather everything is connected together. So I'm very mindful and respectful of approaches that are holistic in nature and approach the body in totality, in physical and mental and spiritual. In the medical representation, metabolic syndrome occurs when we combine adverse diets and lifestyle in a predisposed individual on the basis of genetics, family, epigenetics, that then leads to that visible abnormality of excess fat around the middle, which is really a marker for excess fat around organs like the liver or the pancreas or elsewhere. And the result of having too much fat in our bodies, and especially around our organs, is that we start to produce toxic substances that have an adverse effect on the body, like on the liver, where we might produce too much sugar and not respond well to sugar, that might lead to production of inflammatory mediators. So Dr. Ansari said the importance of introducing antioxidants is really critical to blunt these sorts of pathways. The production of fatty substances can have an adverse effect on our muscles, which are the sink and the places where fuels like glucose are used. And if that balance is thrown off, then we accumulate too much sugar and don't have the energies available so that we can actually do the things that we need to do. Too much sugar floating around will have an adverse consequence on central organs like the pancreas that then leads to early abnormalities in glucose balance, but then later on in the development of diabetes. And then all of this together leads in the bottom part of this slide to the development of atherosclerosis or fatty deposition in our arteries and things like heart disease and stroke down the road. So I think this is familiar to everybody. And this stylized representation again highlights the interconnectedness and the needs for kind of whole body approaches. I'm not speaking to the gut microbiome, the billions and trillions and quadrillions of bacteria that live within our gut, but they also have an important interplay here. And I am confident my colleagues will be speaking to aspects of that part of physiology. So in a North American environment, there have been a number of studies that relate metabolic syndrome. So why is it important? It's because it leads to other bad things. And this is one of the first articles from the early 2000s that looked at the cohort of people that were participating in the famous Framingham cohort studies. So people living in the northeastern part of the United States followed for over decades to see what would happen to them. And in this particular analysis of about 3,000 middle-aged adults, the occurrence of metabolic syndrome was found to be about 20%, as we said. And then importantly, over time, people who had metabolic syndromes, were found to then develop heart disease in various manifestations over the ensuing number of years. In this case, over an 8-year follow-up period, the presence of the features of metabolic syndrome predicted the risk of developing heart disease and stroke over time. The risk was about 2 to 4 times higher if you had metabolic syndrome features compared to people who did not. And importantly, the risk was even higher for women than for men. So this is a very important issue. A more recent analysis in an Asian population in Korea similarly related the risk of diabetes in particular to metabolic syndrome features. And at baseline, it was seen that if you had 0 risk factors or 0 features of metabolic syndrome versus having many features of metabolic syndrome, the risk was doubled. And then if you follow people over time, the risk actually quadruples in terms of development of diabetes. So more metabolic syndrome features is bad unto itself, but it is also bad because it then predicts development of disease over time. This has led many organizations to develop educational materials and campaigns around metabolic syndrome. This is one that's drawn from the American Heart Association. And I'll focus here on the kind of the general advice that might go to the public on how to manage metabolic syndrome, and very consistent to the wise counsel that we've already heard this morning. Here are some of the principles that we would all adhere to. And it's nice that there is actually synergy and we can learn from each other on how to enable these important steps. How do you manage metabolic syndrome in a North American environment? Well, they would say this: eat better. Diet rich in fruits, vegetables, whole grains. And I know there is a whole lot more science underneath this that we'll hear from our colleagues. Getting active, losing weight, and then finally the medical parts of this, of managing blood pressure, cholesterol, and blood pressure. So these will all enter into the discussion. But I agree completely with our colleagues in India that it all starts with eating better. And at this point, I would therefore like to turn this presentation over to my colleague Neelu Delami, who is an outstanding dietitian. She holds a master's in public health. She is a wonderful communicator on the roles of nutrition and in the prevention and management of metabolic syndrome and chronic diseases. Neelu, over to you. Do you want to share your own slide deck?
Sure, I'll do that in a minute.
Okay, I will stop my share and turn to you.
All right. Well, thank you, everyone. I'm very, very honored to be here today. It's been a pleasure listening to everyone's talk so far, and I look forward to learning more from the speakers who are to come. I'm going to spend some time today talking about the role of nutrition in preventing and managing metabolic syndrome. And as Dr. O mentioned, I'm going to be focusing more on the Western approaches, and also really interested to learn more about how we can integrate the approaches. So I will briefly just touch on what metabolic syndrome is, and I'll be very brief with that because I know we've talked about it a few times already. And I will talk about how nutrition is a modifiable risk factor for metabolic syndrome. I'll go through some of the dietary approaches that have been found in the research to support the prevention and management of chronic disease. And we'll talk about how we adapt these dietary patterns for the South Asian population in our programs here. And then I just have some lists of resources as well. So as Dr. O mentioned, metabolic syndrome is a cluster of 5 conditions that can increase the risk of diabetes, heart attack, and stroke. And just to repeat, these conditions include high blood sugar, or glucose, low levels of HDL cholesterol, high triglycerides, a large waist circumference, and high blood pressure. And if you think about the role of nutrition, with all of these 5 conditions, there is some role that nutrition can play. So in terms of the risk factors for metabolic syndrome, some of them are non-modifiable, such as things like family history, ethnicity, age, sex, certain conditions that increase the risk of metabolic syndrome, like polycystic ovarian syndrome or having a history of gestational diabetes. And some of them are more modifiable, so risk factors that we can actually address and change. So these include an inactive lifestyle, an unhealthy diet, smoking, alcohol, and stress. So we've talked a lot about holistic approaches, and with metabolic syndrome, that's absolutely an approach that we do need to take because it is so complex and there are so many risk factors. So I'm just going to focus on the diet piece today, and I know Dr. O will touch on some of the other modifiable risk factors. So I often get asked the question, what food can lower the risk of metabolic syndrome? And the answer is really there's no single food or supplement that will prevent or manage, that will, prevent or manage metabolic syndrome on its own. What actually matters more is the overall dietary pattern an individual follows. So I'm going to go through some of the diets that have been studied extensively in the literature, and I'll start off with the Mediterranean diet. So the Mediterranean diet was discovered after World War II, where a group of researchers looked at the rates of heart disease in 7 different countries, and they found that the rates of heart disease in countries in the Mediterranean area were actually quite low. So they looked into the diet, and what it looks like is, if you look to the pyramid on the left, it includes a lot of fruits and vegetables, whole grains, unsalted nuts and seeds, legumes, so things like beans, chickpeas, lentils, split peas, fish a few times a week, lean meat and poultry in moderation, olive oil as the main source of fat, and very limited amounts of processed foods, red meats, processed meats, and sweets. So a lot of studies have been done on the Mediterranean diet for different health conditions. I'll focus on 2 of the landmark studies that were done. So the first one is the Predimed Trial, and this was one of the largest studies looking at dietary interventions in the form of a randomized controlled trial done. And what it involved was around 7,000 or so participants were randomized to follow either the Mediterranean diet, which is the pattern that we just discussed, or a controlled diet where participants were just told to reduce their fat intake. The participants did not have any cardiovascular disease at the time of enrollment, but were actually considered high risk. And they were monitored for a 5-year period and they were monitored for heart attack, stroke, and death from cardiovascular causes. And the findings actually showed that the risk of cardiovascular events was reduced by 30% for people who were following the Mediterranean pattern. They also found that the risk of diabetes was also reduced. The next landmark study was the Lyon Heart Study, and this study actually looked at secondary prevention. So around 605 participants who had a previous heart attack were randomized to either follow the Mediterranean diet or a control diet. And the primary endpoint was to see if they had another heart attack or if there was death from other cardiovascular causes. And the researchers actually found that the risk of recurrent heart attack was reduced by around 50 to 70%. And this was so significant that they actually stopped the study early, or so all participants could get the benefits of the Mediterranean diet. Now, since then, lots and lots of studies have been done on the Mediterranean diet, and they're looking at things like, of course, diabetes prevention and management of heart disease, also things like dementia and cognitive impairment. There's a lot of research being done in that area. They're finding that the Mediterranean diet has potential to lower the risk of cognitive impairment as well. On the Cardiac College website that is developed by the Cardiac Rehab Program at UHN, there is a score tool that you can actually use to see how close you are to the Mediterranean diet in terms of how you're eating right now. It's 13 questions, and you sort of go through the 13 questions, and at the end you get a score out of 13, and anything above a 9 is considered good. It's low risk. Anything below an 8 is where we sort of suggest making changes to be closer to the Mediterranean diet. And every point that you add lowers your risk of heart disease further. And that's something that we use a lot with the patients who come through the program. So the next diet that I will go through is the DASH diet. The DASH diet, or Dietary Approaches to Stopping Hypertension diet, is a therapeutic diet that is used for lowering blood pressure. It's, again, very similar to the Mediterranean diet. Primarily plant-based, whole, unprocessed foods are the base. So again, your fruits and vegetables, your whole grains, your unsalted nuts and seeds, and legumes like your beans, chickpeas, lentils, some low-fat dairy, lean meat, poultry, and fish, and healthy fats as well. Now, what's a bit different with this one is that you actually have specific serving sizes here. So, for example, 8 to 10 per day of fruits and vegetables, 7 to 8 servings of whole grains per day. And the diets may or may not, in the research, some studies tend to limit sodium, and some studies, do the DASH diet with like a standard amount of sodium. And what they find is that the DASH diet, even when there's no restriction on sodium, can significantly lower blood pressure. So in individuals with hypertension, the systolic blood pressure can come down by 11.4 and the diastolic by around 5.5. And you also find that in people without blood pressure that there is some reduction. So if we think about prevention, that's something to consider. So again, systolic blood pressure may come down by 3.5 millimeters mercury compared to the control, and with diastolic around 2.1. Now, when you do put those restrictions on sodium, so if you reduce sodium to 1500 milligrams or 2300 milligrams, the reductions in blood pressure are actually greater. And they've also done research on the DASH diet in things other than blood pressure. So it does tend to reduce the risk of diabetes and kidney disease, and is also used in the management of gout as well. The next diets that I will touch on are vegetarian and vegan diets. In the West, they've sort of become more popular over the past decade, but you know, as we all know, in some regions in South Asia, vegetarian and vegan diets have existed for a very long time. So vegetarian and vegan diets are, of course, mostly plant-based. In some vegetarian diets, it may include eggs and dairy. And because of the nature of the diet, where there are lots of whole, unprocessed plant foods, it's very rich in micronutrients and antioxidants. And ultimately, following the vegetarian or vegan diets, assuming that they're a healthy version of the vegetarian and vegan diets, there are, you know, a lot of processed vegetarian and vegan products out there. So assuming that it is a whole foods vegetarian and vegan diet can help lower LDL cholesterol, blood pressure, blood sugar, and inflammation, and ultimately reduce the risk of things like heart disease, diabetes, stroke, and some cancers as well. Now, a final dietary pattern that I will talk about is the portfolio diet. So the portfolio diet was actually developed in Toronto at St. Michael's Hospital, led by Dr. Jenkins and others. It's called the portfolio diet because it includes a portfolio of cholesterol-lowering foods. So if we look to the image on the left, there are 4 groups that are part of this. So we have nuts, which the recommendation for this particular diet is to have 45 grams daily. We have viscous fiber, also called soluble fiber, that is found in things like oats. It's found in eggplant and okra. It's found in beans, lentils, chickpeas. The recommendation for this is around 20 grams daily. There's also a recommendation for plant sterols. So plant sterols are substances in plant foods that are similar to cholesterol in structure and compete for absorption in the body. And they tend to lower LDL cholesterol when they're consumed at 2 grams daily. Now, with plant sterols, you can't actually find them. You can find them in small amounts in whole foods, but it doesn't add up to 2 grams. So the recommendation is to have a fortified food. For example, there are fortified margarines or a supplement that would give you 2 grams per day. The last category is plant proteins, and the recommendation for that is 50 grams per day. So this diet can lower LDL cholesterol. Of course, that's what it's designed to do, up to 14–15%. It can lower blood sugar, inflammation, and can reduce the risk of heart disease, diabetes, and stroke, ultimately. So if we think about all of these patterns, the one thing that they have in common is that they include whole foods that come from plants. So if we take all of this research, all of these dietary patterns, and think about a practical guide to meet those requirements and to apply those findings to our everyday diet, one practical approach is to use the new Cannabis Food Guide that was developed in 2019 with all of this research in mind. So what the Cannabis Food Guide recommends is that it should include half a plate of vegetables and fruit, a quarter plate of whole grains, any type of whole grains, and a quarter plate of proteins. So proteins could be from animal sources, but there's also an emphasis of proteins that come from plant foods. So your nuts and seeds and lentils and soy protein and beans and those kinds of foods. Now, you know, a lot of people tell me, like, I don't always eat like this. This is, you know, my plate doesn't always look like this. And the idea is really not to eat exactly like this plate, but to think about having those vegetables as the base of your meal and having those healthy proteins and whole grains as well. However it may look like, it may be a stew, it may be a curry, it might be some other sort of combination dish. But the idea of the plate is just to learn about the proportions. The food guide also talks about other aspects of eating. So just being mindful of eating habits and being present while you eat. Cooking at home more often and using those whole ingredients. Trying to enjoy food with friends and family. And also just being aware of reading food labels when buying packaged foods, avoiding foods that are highly processed, and being aware of food marketing as well, because that can influence choices. Now, I see a lot of South Asian patients, and I often get asked, I'm not Greek or Italian. How can I follow like a Mediterranean pattern or sort of some of the patterns that we talked about? And my answer to that is the South Asian diet is actually very close to that Mediterranean pattern of eating. The Mediterranean diet is usually, it's meant to be adaptable, so you can take it and adapt it to your own culture. So if we look at some of the similarities there, cooking at home, which is part of what we promote, is really traditionally in many South Asian households, most meals are cooked at home using whole foods, really great whole ingredients, those spices that we talked about, the turmeric, the chili powder, the ginger. So that's part of South Asian eating that's similar to the Mediterranean diet. Mindful eating as well, so trying to be present while you eat, enjoying your food, also honoring your body in terms of how much you eat, the portions you choose, the pace you eat at as well. The next is fruits and vegetables. So the goal is really to try to include those vegetables in all meals. It can be as a side. It can be incorporated into curries or other meals as well. Tropical fruits like mangoes and bananas, sometimes there's a fear of introducing those, but if they're eaten in the right portion sizes, they can offer a lot of benefits. Whole grains, so a lot of flatbreads, naans, rotis, chapatis are made with 100% whole grain. So those are really great elements of the diet. With rice, the goal is to choose whole grains more often, so brown basmati rice. And as was mentioned a few times earlier, trying things like barley and millet and other whole grains that have that lower glycemic index and have a great fiber content as well. Healthy fats. So we do try to promote use of more extra virgin olive oil in cooking as a primary source of fat. There are some concerns that some people may have concerns of the way that extra virgin olive oil can't be used in cooking, but if it is on a medium heat, then it's perfectly fine to use it. And the olive oil has a lot of cholesterol lowering as well as anti-inflammatory and antioxidant benefits as well. And nuts and seeds, again, traditionally part of the culture, just making sure to choose unsalted ones. Fish, it's part of the Mediterranean diet, but may or may not be part of the South Asian diet, depending on the region. But the reason we have fish in the diet is for the omega-3 fatty acids. It tends to have many heart-healthy benefits, including lowering triglycerides. And those can actually come from things like chia seeds, flax seeds, and walnuts as well. The next thing is legumes. So very, very commonly used in the South Asian diet. So we promote just continuing to use those on a more frequent basis. Meats, we try to focus more on things like poultry, fish if that's part of the diet, and meatless meals again. So again, those legumes that have all those heart healthy and blood sugar stabilizing benefits. Sofritos, so that is a combination of things like garlic, onions, tomatoes, and it's actually used as the base of many curries. So that's, again, something that's already part of the diet. And to use olive oil as the main cooking oil. The next thing is sugar. As in many cultures, there are desserts that are high in sugar, and sugar may be added to chai. So the recommendation is just to limit sugar, so it meets guidelines for added sugars. And then in terms of dairy, plain yogurt and paneer in some cuisines are something that's added. Milk and other products may not be as popular, but we do encourage for people who do eat yogurt and paneer to include those as well. And if we take that plate method and we talked a little bit about portion sizes, if we sort of take it and adapt it to a South Asian, to make it more of a South Asian plate method, this is sort of how it might look like, where you have those, half your plate is those vegetables and protein, and you have a smaller amount of carb than typically one might have. And of course, you see that there's the yogurt there and a piece of fruit. So that is my piece. I'm really looking forward to learning more about the Ayurvedic diet and how we can incorporate some of those learnings into our approaches right now, and how sort of everything can be integrated. And thank you very much for inviting me today. It's been an absolute pleasure, and I look forward to hearing everybody else's talks. I'll pass this on to Dr. O, and I'm sure if perhaps at the end, if there are any questions, I'm happy to take them.
That's wonderful. Thank you, Nilu. And again, for our colleagues, the approach that we're taking is that this represents kind of the state of the art in a typical Western chronic disease management program. And you see that there are recommendations that are built upon evidence from clinical trials, that there are adaptations kind of locally, culturally, based upon some of those themes. But undoubtedly, you'll see that there are opportunities that we might also bring to the table, as well as, interesting exercises we might go to together, where we can kind of layer or contrast and compare what's in a Mediterranean diet or a DASH diet versus what's in an Ayurvedic sort of pathway, and look for those commonalities where we might be able to deploy something new and innovative and exciting. I'm mindful of time, so I'm just going to quickly run through a few of my slides. I've edited some out so that we can leave lots of space for our colleagues. Kind of rounding out the Western approaches to metabolic syndrome would, of course, after food, be a call out to getting active. And this is a slide from a current Canadian guideline around how to make your day more active on a 24-hour basis, that would include not only time for structured physical activity, that would include aerobic activity, as well as muscle strengthening or resistance exercise, but also just being active throughout one's day. And also on the counter side of being mindful to limit sedentary time sitting, and I'll talk a little bit more about that in a moment, the perils of screen time that are ubiquitous today, especially during time of pandemic, and making sure that we get to all of the important restorative periods of sleep. And I know this is very consistent with holistic Ayurvedic approaches to health as well. In terms of the Western literature and looking at the importance of physical activity and fitness in metabolic syndrome, there's a number of studies that were well summarized by one of my colleagues, Jonathan Myers, that speaks to the impact of exercise on addressing many of those defects on the pathophysiologic cascade that we described, where all the organ systems are affected by metabolic syndrome. This is a way of turning some of those things back. And of course, we're well aware of the importance of physical activity, exercise, and heart disease and diabetes and blood pressure, etc. The challenge that we face in our world on the Western side is how might we best incorporate physical activity regularly? There are some programs that, like ours, where this is a core intervention, but elsewhere throughout the medical community, we do we kind of pay it so-called lip service, the Western term for this, that we talk about it, but most people don't actually do it. So there remains a divide and an opportunity. On the notion of sitting and sedentary behavior, this was one study that our team published a few years ago, where we were able to demonstrate from a cross-section of the medical literature that sitting for prolonged periods of time actually increases cardiovascular disease and diabetes and death. So we've been on a campaign about being mindful of not sitting for too long, and hopefully some of you are actually standing during this presentation. On a metabolic basis, like here's one illustration that one of my colleagues in the UK presented from a study of office workers. And they're able to show that if you follow the blue line, this represents the sugar profile in response to a standard lunch for people who were habitually sitting in terms of their jobs. The yellow represents when people were actually just asked to switch their sitting behavior to standing behavior throughout the day. And they didn't have to stand all the time. They just had to break up their sitting on a regular basis. And they're able to show that the glucose profile levels were actually about 40% lower simply from introducing standing as a regular maneuver. Now, think if we could even make that more purposeful by bringing in yoga and other things throughout the day, but it just speaks to the power of simple physical activities. Last 3 slides about guidelines, that if we think about metabolic syndrome as disorders of sugar and cholesterol and blood pressure, well, there are Canadian and other North American guidelines that speak to how we might manage elevations in all of these parameters. And this from the diabetes guideline would say, if your sugar is up a bit, as it is in metabolic syndrome, then we'll start with lifestyle changes. And if that doesn't seem to do the trick, then we'll move to drug therapies like metformin. So there's some commonality in what we do here. Unfortunately, again, we're not very good at inducing lifestyle changes in general in Western medicine. So often we end up moving to drug therapies, but we do emphasize that lifestyle is the first thing to do. Similarly, for cholesterol therapies, there's a new guideline that came out this year in Canada, and we will start with categorizing risk of individuals. Most people with metabolic syndrome would be defined as a future cardiovascular risk that would be deemed, quote, intermediate, and therefore we'll start with lifestyle, health behavioral modifications, and then move into drug therapies as necessary on an individualized basis. And then finally, for blood pressure, there is a Canadian blood pressure guideline that for people with minor elevations in blood pressure over a period of time, we're going to again start with health behavioral interventions and then move to medication options. And there's many drugs that are available similarly in India as in Canada. So if we don't get this right, then people can end up on many medicines, cholesterol, blood pressure, diabetes, aspirin, many other things. But if we do it well, as Dr. Nassari indicated at the beginning, that if we can do a proper program very well and really do the health behavioral managements and get the diets and physical activity programs right, then we don't need to move on to these medicines. And arguably, of course, that this is much more effective in terms of addressing all of the issues altogether and reversing those disorders, derangements that occur with metabolic syndrome. So there's going to be opportunities for integrated approaches, and I look forward to this discussion. We both agree, though, that health behaviors should be first. We can make these things better with innovative approaches to nutrition, physical activity, and exercise. And there are opportunities to use medications judiciously, and I think we would even agree with that. But we can expand certainly our Western universe, thinking about what sorts of supplements, other sorts of interventions that we might provide in addition to or instead of kind of Western pharmacotherapy. All right, I'm going to stop there and turn this over to our colleagues for their ideas on how we might address this. So Satish, I don't know if I'm turning it to you to go to the next parts of this presentation.
Absolutely. Thank you, Dr. O and Nilu, for your great presentation and some valuable insights and advice. So now let me invite Dr. Pramod Yadav to begin with. Dr. Pramod Yadav is having over 7 years of teaching and research experience. He's working as an assistant professor, Department of Rasa Shastra, All India Institute of Ayurveda, New Delhi. He has done his PhD in IPGT and RA from Jamnagar, India. He has over 10 published research papers, and his area of research has been very, very diverse. And we're looking forward to your presentation. Dr. Pramod, over to you.
Thank you, Satish ji. Thank you for that wonderful introduction. And I'm very much thankful to be part of this elite group for giving me an opportunity to share the views of regarding the management of this metabolic syndrome through the Ayurvedic diet and lifestyle measures. And we have also, I'm very much honored to have the presence of Consul General of India in Toronto, Ms. Apurva Srivastav, Vaidya Manoj Nesri, Advisor, Ministry of Ayush, Professor Tanuja Nesri, our Honorable Director, All India Institute of Ayurveda, Dr. Harish Verma, and Mr. Satish ji and Ritesh ji. So good morning in Canada, and good evening to all my colleagues from India who are listening. A brief overview of this management of metabolic syndrome has already been given by our Honorable Advisor Sir and Director Ma'am. We already have been highlighted that what is metabolic syndrome, which is this disarrangement. It becomes a syndrome when the patient has any of three of the following, having a waist circumference of more than 40 inches, or elevated level of triglycerides, and also reduced high density lipoprotein cholesterol. So these things leads to a cascade of events, and we see alterations in the vascular smooth muscle cells, and also there is changes in the endothelial dysfunction, and which leads to other events. And there are certain triggering factors like smoking, obesity, lack of exercise, sedentary lifestyle, faulty dietary habits. And these all leads to the narrowing of arterial lumen or impaired vasomotion. There can be platelet activation, and stroke, CAD, cardiomyopathies, hypertension, dyslipidemia. So it is a cluster of all these diseases, and recently cancer and polycystic ovarian syndrome has also been added to this group, which makes it very difficult for one to treat it. So coming directly to the point, what are the principles which have been given in Ayurveda regarding this management of metabolic syndrome? We know that in the recent COVID pandemic, the patients who were predisposed to the factors like hypertension or having cardiomyopathies were very much prone for the mortality was really very high in such patients. And that is the place where we find the importance of diet and lifestyle in our lives, because we should be ready for any condition which does not have a cure as such. So as it is said that we are what we eat. So therefore, it is very important for us to judiciously choose our food, our diet, and our lifestyle. In Ayurveda, the diet has been termed as Mahabheshaj. Mahabheshaj means the greatest medicine. And we know that the two main principles or objectives of Ayurveda are the Swastha se Swasthya Rakshan, that is the maintaining or preserving the health of a healthy individual, and second is the palliation or curation of disease. So these both conditions can be effectively managed by a very effective diet and lifestyle. So diet and lifestyle also has a main role in causation as well as management of any disease. So we should be very wise to choose our diet and lifestyle. Again, Charaka Samhita, which is nearly 5,000-year-old, gives a very apt quotation: Ahar sambhavam vastu rogascha ahar sambhavaha hitta hita visheshascha visheshaha sukha dukhayoho. Which I would like to just translate is that the origin of life and disease is because of food. Wholesomeness and unwholesomeness food articles are responsible for happiness and sorrow. And food itself decides whether the human being can or cannot sustain the disease of a body and the mind. So we can see here that the evolution of human being has been very much widely dependent upon what were our dietary principles or dietary or eating habits. Similarly, culmination of disease is also because of this faulty diet and lifestyle. So in Ayurveda, as I told, that the first objective is to maintain health of a healthy individual. And again, it is dependent on a very sound and diet and lifestyle. So Ayurveda has given a code of conduct like do's and don'ts for daily regimens. We have seasonal regimens and we have ethical regimens also. Daily regimen are the daily practices which should be followed to maintain a healthy lifestyle. And also it gives an account of activities that needs to be undertaken right from arising early in the morning to going to bed. Again, there are seasonal regimens, and also and there are different seasons, what to eat, what not to eat according to that season. So these needs to be followed strictly to maintain our health. And as it is said that like the body is a small cosmos in itself, and it represents the universe. So as the season changes, the pattern or the rhythms, circadian rhythms or the biological rhythms in our body also gets changed. So to attune it to the season, it is necessary to follow the diet and lifestyle which has been prescribed in our ancient and classical texts. So depending upon the severity of the disease, the Ayurveda proposes the two main, you can say, the principles of treatment. The first one is the Shodhan or the purificatory measures, which my colleague Dr. Prashanth will be taking in detail. And second one is the Shamana therapy, or we can say the palliative treatment. In the palliative treatment, different modules, different measures are followed. It can be through medicine, it can be pharmacological approach, it can be non-pharmacological approach, or it can be extra pharmacological approach as well, where we make use of appetizers, digestives, animation medicines, and also we have a class of medicines called Rasayana, where Shilajittu-like drugs are used for management of this metabolic syndrome. Coming to the Langhan Upakrama, which is a reduction therapy, which is mentioned in the ancient text of Charak Samhita. There are 10 principles which are to be followed for an obese person, or you can say overly nourished person, where the first principle is the emesis or the vamana, the second is the virechana, niru, basti and nasya. So these are the principles of Shodhan, which will be covered by my colleague. And also Ayurveda has given guidelines for the pharmacological and non-pharmacological approach in form of pipasa, that is controlling one's thirst, or marut, that is breathing exercises are to be followed for maintenance of health, atapa, that is exposure to sunlight, and use of certain medicines for digestion of extra clay which is present in the body. Fasting and exercise are also measures which have been advocated in the Ayurveda. So when I went through this classical text, I found this quotation where a large number of medicines like the, you can see the guduchi, which is the Tinospora cordifolia, or musta, Cyperus rotundus, triphala is advocated. Certain millets and grams have been advocated. And to my, I was very much astonished to find out that the quotation which I have highlighted, that is the Yavamalak Chudam cha Prayogasresh Uchyate. A combination of Indian gooseberry and barley has been said to be the best in management of the diseases which arise due to this metabolic syndrome. And very recently, in this February 2021, an article I found that it was published online where Emilic officinalis and Hordeum vulgare, the mixture was found to be regulating the lipolytic activity in differentiated T3L1 cells. So whatever the principles have been given in our classic book have a very sound scientific background, and they are being explored in the relevance of modern terms to give a justification of the ancient long lost tradition. As I told that the therapy, certain drugs have also been given in our Ayurvedic text, like the Cyperus rotundus, the kusht is given, or haridra or haldi, which we say, taru haldi, ativisha, vacha, chitra, kutki, chirbil. These are certain medicines which are prescribed for the conditions of metabolic syndrome. Apart from that, coming to our kitchen, which is itself the first dispensary which we consider, and there are many things that we can utilize from our kitchen and utilize it for this management of metabolic syndrome or metabolic disorders. So the first thing that comes into our mind, and very much also in this COVID era has been researched upon, is the what we call as turmeric or haridra, and haldi, which has this presence of curcumin or keto form of curcumin or enol form of curcumin, is a very good antioxidant and has shown anti-apoptic effect and anti-inflammatory activity, and very much protective against diabetes and diabetes induced complications, because it is very good in decreasing this incidence of type 2 diabetes mellitus and atherosclerosis in patients with this type 2 diabetes. And in experimental animals also, it has been shown to reduce the insulin resistance in rats, and also with polycystic ovarian syndromes in the cultured human HEPA G2 cell lines. And at different doses and for different intervals it was given, and it has shown to be very good in mitigating, in reducing the body mass index and fasting blood glucose, sugar, glycosylated hemoglobin, and insulin resistance. So incorporating haridra or turmeric into our diet, because Indians are habituated, if we do not see the color of our curries or color of our vegetables, what we cook, to be yellow in color, so we do not find it very appeasing or appealing. So there is a tradition that Indians always are fond of adding this turmeric, and it is one of the very important spices in our kitchen. Another spice that is very much helpful for this particular syndrome is the we called as adrak or ginger. So the fresh ginger is used very much in form of dips or chutney, what we call. And in Ayurveda, the dried form of ginger is very much used. The fresh ginger, it contains gingerol, 6, 9, and 10 gingerol. And when we dry this by it heating or treating it with certain acids, it gets converted into shigols, 3, 6, 9, and 10 shigol. And this is also very much helpful in mitigating these symptoms. And one of the studies that I have presented here, where the ginger supplement was used and the effect was proven on anthropometric, glycemic, and metabolic parameters in subjects with metabolic syndrome. So that for 12 weeks, this treatment was given in a dose of 2 gram ginger powder per day. And there were significant changes observed in weight, waist circumference, LDL, HDL, total cholesterol, systolic and diastolic blood pressure, and energy intake between the groups. And it is suggested that it has a very good effect owing to its antioxidant property, anti-inflammatory property, and it regulates the lipid profile and also inhibits the platelet aggregation. Another very important herb from our kitchen is the garlic. And garlic, as we know that it is very much rich source of antioxidants, and it is prescribed in different form in Ayurveda. It is given to be in form of shirpak. It has been told to be medicated with milk and administered, and it is having very good lipid lowering effect. So very much preferred in cardiovascular disorders, metabolic disorders. It is an anti-inflammatory also. And the researchers have shown that administration of 1.6 gram garlic powder per day has led to significant increase in high density lipoprotein cholesterol and significant reduction in waist circumference, diastolic blood pressure, fatty liver index, and insulin. So this garlic can also be incorporated in our diet in different ways by following the principles of Ayurvedic cookery or Ayurvedic methods of cooking and incorporating into day-to-day eating habits. Another herb which is very much used in India is the curry leaves. And curry leaves have also demonstrated its effect in the mitigating the symptoms of insulin resistance and inflammatory alterations. Coming to the coriander sativum or dhania, what we say in Hindi or common language, is also a very wonderful herb, and it is a wonderful food and very good functional food. And it is also used traditionally in our kitchen in form of spices in India. And at the subchronic administration of these extracts of this particular plant have shown to elevate the levels of decrease the elevated levels of insulin and low density lipoprotein and triglycerides. And also it is found to be very effective in the management of the disorders because of the presence of linalool, which is the active principle in Coriander sativum. So you can call it as a functional food also. So very good effect, very good antioxidant, and has also very good hepatoprotective activity, hypoglycemic and hypolipidemic activities are present in this particular plant. Marich, that is the piper. So the black piper or even pipili also, the piperine is the main ingredient, and this piper is dusted on the food, on the curries or food items that are being ingested, and has a long tradition in the Indian culinary science. And I will call it as a science because it has a very scientific background, and recent advances have proved that supplementation with resveratrol and piperine had led to the decrease in the inflammatory markers, and it is due to the mediation of different at different cellular levels. So piperine is another, marich is another herb which can be incorporated into our diet. Fenugreek or the methi. Methi is the another plant, another component which is traditionally used in our spices And the ameliorative effect of this methi has been found to be on the lipid profile, and also it is a very good hepatoprotective. And the presence of the diosgenin and 4-hydroxylinolol, which are the active principle and soluble fibers. This Fenugreek has ameliorated dyslipidemia by upregulation of LDLR gene expression, and can it also be used to be a protective agent against hypercholesterolemia. Then the cinnamon is another wonderful herb, and it has also has a large number of alkaloids and active principles like the cinnamondehyde and cinnamate and cinnamic acid, ethyl cinnamate and eugenol. And in trial, 16-week double-blind randomized trial on 116 individuals, the intervention was given of cinnamon, and it was found that it led to significant improvement in all the components of metabolic syndrome in sample of ancient Indians in North India. So medicated water with this cinnamon can be used and can be brought into practice. Nigella sativa is another wonderful herb which can be effectively used because of its antioxidant and anti-diabetic, anti-hyperlipidemic, anti-inflammatory, and anti-cancer properties to break this pathogenesis of metabolic syndrome. Similarly, the black cardamom or the badi elaichi has been found to be very effective in this alleviating the metabolic syndrome and reversal of diet-induced, we can say, the adiposity or trans body fat mass and systolic blood pressure and plasma glycerides. And it has the presence of active ingredients, vitamins, and it also can be termed as a superfood. So the black cardamom is more effective in reversing the signals of metabolic syndrome than green cardamom. It has been found out. As we know that amla, or another superfood, that is the Indian gooseberry, which is very much rich in dietary fibers and nutrients and vitamins and minerals, and has a multifaceted action. It is not only a rejuvenator, but also it can be used as sadapatya. Every day it can be taken or consumed, and particularly in the winter season, which is the time in which the fruits are ripened. So there is a tradition in India that we make chawanprash out of it, and it is being consumed, which not only is very good for our body, but also for our memory. And it is a very good and rich antioxidant and free radical scavenging property. And it is also good for eyesight. Talking about the grams and we can say barley. Barley is now very much popular in the cases of diabetic, where it is a traditional and trend in India to advise patients to have the chapatis or roti or the soft bread made out of barley, equal proportion of barley and grams, instead of plain wheat or maida or the refined flour, because of the as we say that in the patients of santarpan or metabolic syndrome, the principle of Ayurveda says that the diet should be guru and apatarpan. So the guru, which means that which is heavy to digest and having a low glycemic index. So should be rich in fibers, so that there is a feeling of satiety, and it signals to the central nervous system about the feeling of fullness. But on the other hand, it does not provide that much calories to the body, having a very low glycemic index. In that context, barley is very much effective replacement for the refined flour or wheat, or it can be mixed with other flour like jawar or bajra, and can be very much effectively used in these patients of metabolic syndrome to lower down their sugar and cholesterol levels. And these studies which I have presented here and collected have been shown that the patients, the highland barley whole grain has been used to ameliorate hyperlipidemia by modulating fecal microbiota and amylase. So in this one of the study, the test group was given this diet of barley whole grain diet was given, and the investigations were carried out, blood samples were carried out of the patients of metabolic syndrome, and their fecal samples were studied, and the gut microbiota analysis was done after this intervention. And it was found out that there were decrease in the total cholesterol and increase in the short chain fatty acids, Also, there was decrease in the diversity, and richness was observed in the certain gut microbiota, which are very much helpful for maintaining the healthy metabolism in our body, was found to be increased. And there was no difference in the gut microbiota in its composition. So in another study, which was in animals, it was found out that this Hordeum vulgare, or we call it as a barley, it was found to increase it was given in the patients having increased body weight and free fatty acids, and it was found to reduce the BMI and dietary free fatty acids, reactive oxygen species, lipid peroxidation, and expression of PPAR. This PPAR gamma is an enzyme which is very much responsible for signaling the tissue distress, and because of this, it was found to be altered. So ragi can also be considered to be in the same group and can be effectively used in different forms for these patients of metabolic syndrome. Buttermilk is also another functional food or superfood. We can say that it is very much effective, and the studies are there to prove that it has altered the gut microbiome in the obese individual and has led to the decrease in the cholesterol levels. Honey, as our director have already stressed out, that honey is a very important component in our diet, and it can be effectively used in these patients of metabolic syndrome. The mechanism has already been studied and published, where the possible mechanism of action that I have collected here has shown that it is very good in ameliorating the signs and symptoms of metabolic syndrome, whether it is hyperlipidemia or blood sugar levels. So it has been very much effective because of these polyphenols which are present, or kumaric acid which is present in the honey is responsible for bringing out this anti-obesity, hypoglycemic, hypolipidemic, and hypotensive actions. So again, coming to the non-pharmacological approaches which has been advocated by Ayurveda, one of the important is the Langhan, that is the intermittent fasting, which is been advocated. And this intermittent fasting not only improves the gut health, but also regulates or channelizes the circadian clock, and improved biomarker like improved sleep patterns is observed. So because of this, the metabolic regulation is brought into, and insulin regulation, and lowers this LDL. And because of the less inflammation and hunger hormones, it prevents obesity type 2 and cardiovascular diseases. In one of the studies which has been published, where study was carried out for 1 month, and the subjects with metabolic syndrome were advised for this intermittent fasting. They were not allowed to eat anything before after the sunset, and before the sunrise. They were advised to keep fasting, and after this study was carried out, it was found that there was reduction in the weight, body mass index, and waist circumference, and insulin resistance were also found to be down, and their anti-cancer serum proteomic signature was found to be increased. So there was signs of DNA repair, and insulin sensitivity was improved, and the proteins associated with prolonging the longevity were also increased. So the intermittent fasting is a very when used judiciously under the supervision of an medical healthcare practitioner, can bring wonderful results. Talking about the lifestyle, it's not only that the recent advances have shown that lifestyle is an important component, but Sushruta Samhita, which is a text written some 5,000 years back, has advocated the importance of regular physical exercise, wrestling, active sports, or at that time it was riding a horse or an elephant, long walks, pedestrian journeys, practicing archery or casting of javelin was advocated to person in which the disease has gone to an advanced stage. Even depending upon the class of the people, whether they are rich or whether they are poor. So they have been advocated, like for a poor and friendlyless patient who has no money, so he has to walk some 100 yojan. That is the 1 yojan is equated to some 10 miles. So that way the patient can walk. Depending upon the capacity of a person, he can follow this lifestyle regimen, and it is very much clearly mentioned in our classical text that what type of lifestyle he has to follow. Coming to the non-pharmacological interventions like yoga, yoga has already been mentioned about by our eminent speaker, Dr. Paul, that it can be very much integrated into the lifestyle of this youth. And since it not only has effect on the physical entity, but also the mental entity, which is very much important in these cases of metabolic syndrome, because a stressful life will lead to further complications. So there are different components like Surya Namaskar, Padahastasana, Ardhamatsendrasana, or breathing exercises can be carried out effectively. There are papers supporting their effect, and here I would like to just point out that 1 year yoga schedule in which these patients were advised for 60-minute session of this yoga, in which the Hatha Yoga was advocated to the patient, was administered to them in different asanas like Uttanasana or Utkatasana. The patients were asked to carry out this asana. So this was a randomized, controlled, parallel, open-label trial, and nearly 4,000 patients were enrolled having this metabolic syndrome. And after this completion of the trial, so there was reduction in the number of diagnostic components. The waist circumference was significantly improved, and trend was seen towards decreasing the systolic blood pressure. So this, again, a follow-up of this particular study was carried out, and this 1 year yoga intervention modulated the circulating level of ghrelin, gene products, and growth hormone, while providing beneficial effects on physical performance and central obesity in adults with metabolic syndrome. Yoga and pranayama has also been shown to be very much effective on practices on metabolic parameters and anthropometry in this type 2 diabetes mellitus, where these diabetic patients were administered the yoga protocol, and their parameters like fasting and postprandial blood sugar, HbA1c, and triglyceride profiles were carried out, and they have shown to have significant effect on these parameters. Now, as our Honorable Director mentioned about the initiatives of All India Institute of Ayurveda, so we are very much proud to say that we run a diabetic and metabolic clinic, and from the data from 2016 to 18, which was available with me, so nearly you can see that we have treated around about 25,000 patients during that duration, and we found out that the mean fasting blood sugar levels, which was on an average 220, reduced to there was 37.2% reduction in the patients with this fasting glucose, and 40% reduction in postprandial glucose, and in HbA1c there was 23.7%. And statistically, after analyzing the statistics, we found that it was statistically highly significant result. And on this observation, on this we can say that on this observation, the institute has come out with a protocol for this management of diabetes mellitus and its complications. So we are identifying the pre-diabetic conditions, the early diabetics, and chronic diabetes, and then managing the diabetic complications. So this is an experiential data on the pure practice of Ayurveda integrated with diet and lifestyle and counseling, and the epidemiological data that we have collected since this past 6 years. We have come out with this protocol. So now we can understand that the importance of diet and lifestyle, which plays in managing this metabolic disorder. So it is upon us whether to choose the diet and lifestyle judiciously. We want to be fit or we want to be fat. So yes, we have messed up. So it is the right time that we can go back and try thinking on the lines of holistic healthcare, so that food be our medicine, or else medicine will be our food. So with this, I would like to thank the organizers, the Canada India Foundation, and for giving me this platform, and especially the Ministry of Ayush, Vaidya Manoj Nesi, Advisor, Ministry of Ayush, and Professor Tanuja ma'am, for giving me a platform to share my views. Thank you very much.
Thank you so very much, Dr. Yadav, for your insight. It was very, very helpful. We will be leading for the Q&As shortly. May I request now Dr. Prashanth Dharmarajan to share his presentation. Dr. Prashanth, over to you. Thank you so very much for joining, and over to you. I'm just skipping your introduction because we have already shared your bio. Just looking at the essence of time, I'm just missing your introduction. Please, over to you.
Am I audible, sir?
Yes, absolutely.
And the slides are visible, sir?
Yes.
Okay. Namaste, one and all. Excellency from the Consulate General of Canada, the Canada-India Foundation, my advisor, Ministry of Ayush, Honorable Manoj Nisri sir, and my beloved Director, Tanuja Nisri madam, and my colleagues, and all who are there today. As I think you can hear the background from India. Diwali is not yet over, it's going on. So in the meantime, we'll talk about the management of Ayurveda, management of metabolic syndrome. So if we look at the metabolic syndrome, it's also called as syndrome X. So if we look into the way how we advance, we have traveled from cave X to space X, but then now heading to syndrome X. Because if you look into the statistics of what the world is going through about this metabolic syndrome, it's highly alarming. And by the year 2030, it is anticipated that it will be extremely uncontrollable if we don't take a kind of action right now. When I was going through the things that is happening in and around Canada, what I could observe was that around 40% of people above the age of 65 is already having metabolic syndrome, and Canada has started taking steps in a very different way. And there are different guidelines. For example, even if it's obesity, it's not just judged by the weight of an individual. If it's recommendations about various aspects of health, it's about improving the access to healthy food, controls on marketing of processing food. So there are many policy and many other changes that is happening inside the country to actually have a control on this factor. As we know, in the present contemporary science, we have a lot of difficulty in finding the exact cause. Most of the time, it is being hypothesized that these are the reasons actually which causes this metabolic syndrome. So these are the most common symptoms that anyone can diagnose themselves to be having this. So these are the common clinical features. And as my colleagues have already very clearly mentioned, most of the things that we come across today is basically associated with this metabolic syndrome. So trying to understand metabolic syndrome in Ayurveda, the first concept that I want to convey that Ayurveda tells about is Sneha Saro Ayam Purushcha Pranascha Sneha Tishtati. It means a man is composed of optimal constitution of lipids. When there is a derangement of this constitution of lipid, he will be having many disorders, and most commonly the disorders as what my beloved advisor was telling, Santarpanajanya Vikara, the kind of disorders which causes due to overnutrition or sometimes a derangement of metabolism. Basically, it is the disturbance of Medo Dhatu we call. Medo Medas means the fat, the body fat or lipid. The Meta Dhatvagni is responsible for that. The kind of metabolism that has to happen to transform it as somewhere changed. So that's the reason. So when you actually look into the Ayurveda concept of a nutrition, we have to understand Agni or the fire, the appetite or the hunger. It plays a very important role. It is not just about having food, but the appetite or the kind of activity in the body, which is mediated by a digestive fire, what we call Agni. It actually decides whether food is being digested or whether it will be converted into something undigested called as Ama. So if it is, more, then it might go into Apatarpana Vyadis. And if it is less, it might go into Santarpana or obese kind of, Santarpana or more Vyadis which are coming under our syndrome X or metabolic syndrome. So now, when we look into the nutrition concept of modern science and Ayurveda, modern science always speaks about required calories for the body, which is formed with a balanced, nutritious diet and lifestyle. And if it is so, we have one more part which comes, the part which plays a major role, that is the person itself. And that is the advantage of Ayurveda. The person is concerned. It is the assimilation factor. So Agni is the most important assimilation factor. I've written 2 sentences on the right. Even though the cooking methods are varying, choosing the right fresh nutritious food in right quantity with right time to intake is very important. The temperature and the time of cooking, according to the raw material selected, decides the nutrition to be assimilated still, which is influenced by various intrinsic factors of the body. So this is one basic outline that I want to give when you actually think about nutrition and metabolic disorders. So if you look at a person, you all know that Ayurveda speaks about 3 kinds of basic constitutions. And in those 3 constitutions also, they are very customizedly told about the kind of Agni or the metabolic fire that will be active. In Vata Prakriti, there will be Vishamagni, very altering appetite. And these people are commonly having hard stools, sometimes diarrhea, very irregular diet habit with gas. When Pitta people having very Tikshnagni or very fiery, we call them because they have the constitution with the fire part in them. They have very severe appetite, but they have very regular bowels and very soft, watery formed stools. But when it comes to Kapha, there is Mandagni or very less appetite, and there are hard or constipated stool, which is always altering. So now understanding oneself based on one's own constitution or Prakriti is very important to kind of choose the food and have the kind of meal or morsel that you need to take. When you go somewhere and sit in a social meal, we usually don't think about it. We just need to complete right from starters to the dessert. So it is very important to understand oneself. And that is the best part of these Eastern sciences, wherein they ask you to look inside ourselves. So if you look into it, the Agni is the one which actually digests. So if these things are taken, snigdha, oily, or heavy, or sticky, or increased alcohol intake, or sedentary lifestyle, these are specifically quoted in Ayurveda, and it feels really so happy to explain that these were told 5,000 years back. If you involve in these kind of food items, your digestive capacity will come down, and this will actually make accumulation in the body, and this will cause blockage of various channels in the body, and it will cause adipose, or there will be fat which will be accumulated through the channels or viscera across the body, and this can show into various symptoms throughout the body, causing us different diseases. So this is the basis, pathogenesis of metabolic syndrome that we can understand in Ayurveda. And more importantly, they have even converted this into various stages. Like what we understand in modern medicine, we can also understand this in the perspective of Ayurveda with these commonness which is being explained in Ayurveda, wherein each lakshanas or each kind of specificities are also being mentioned. Stage 1, stage 2, and stage 3. We can actually understand from the perspective of Ayurveda these things also in a very beautiful way to understand the concepts of how this is being observed in Ayurveda and how it can be managed, because the management is based on these stages. So basically, if we overlook into the management principle, as I've shown in the image, it's all about a harmony. A body, mind, and soul is made in harmony with the nature. As my director has already quoted, we are a part of the nature and we forget it as we advance. And it's the balance which is being brought back. To bring back the balance, the first step done is to eliminate the root cause. So as per the contemporary science, the root cause itself is very vaguely known in most of the diseases. But in Ayurveda, these root causes are very clearly explained. Then there are these elimination or cleansing therapies. It's a very popular term, panchakarma, but in spite of that, it has a lot of in-depth, science in it to clean the body. Then there is a palliative care wherein actually these things can be brought down to a certain level so that things are set up and moves in normalcy. Also, there are beautiful herbs and drugs which can clean the channels and also improve the immune system, which are called as Srota, Shodhana, and Rasayana, which already Dr. Pramod has told about, Amlaki, Avla, etc. So we will once again just move around these things. So I've already told oily or fatty, heavy, sticky, overuse of alcohol, Atyashana. If you actually look about the concept of eating, Ayurveda has a lot of rules and regimens. Ayurveda acts as a manual for even eating. There is Bhojana Purva Karma, which has to be done before taking a meal, which has to be done just during the meal, and which has to be done just after consuming a meal. Every Indian should know that we should at least walk Shatapata. At least 100 steps should be taken after having a meal. This is the Paschat Karma. Same way, there are many factors which are explained about how to prepare a food, how to take a meal, how one should behave after taking a meal. So it's like multiple level. It's a very good guideline which is told. And all these things like Snigdha, Guru, Pichila, Madhyapana, Avyayama, all these are very clearly explained in the Ayurveda classics when you look into the concept of santarpanottha vikaras. So if you look into the evidences, we can see that these lifestyle changes and prevention of metabolic syndrome, it is very easily understood that such lifestyle changes have brought changes even in the metabolic syndrome. But what about weather? So that is the advantage of Ayurveda. Ayurveda, when looking into a common man, sees at least 10 different variables. Dosham, Dushyam, Balam, Kalam, Prakriti, Anala, like at least 10 different multiple factors are considered in an individual to understand the individual and understand his pathology. So even Desha and this Kala is the weather, which can also influence the metabolic syndrome. So now coming to the way how we are actually doing it under the Panchakarma. So initially I told the first one, Nidana Parivarjana, avoiding the causative factors was step 1, and the step 2 is to actually cleanse the body. So seasonal purifications are told in Ayurveda on behalf of Panchakarma to eliminate the toxins. But specifically speaking on metabolic syndromes, if you look at this first, second, and third stage, we have various therapies or various principles of treatment which are told. For first stage, there is powder massage. There is diet, which already have been explained. There is, diet and medicines which actually eliminate the bowel. There are therapeutic enema, one of the major treatment aspect of Ayurveda. There is fasting therapy. There are dry external therapies. There are cleansing therapies in stage 2. In stage 3, there is complete channel cleansing therapy. So it's like various stages. It is very crystal clear and it's very precise to approach the syndrome, not just as a syndrome alone, to the patient, to the person who is suffering from that, looking into the intricate aspect of it. And it's so beautiful that once when you start practicing it, you will really enjoy it. So deep dry udvartana or powder massage with herbal powders, it will actually rub away the dry, the dryness will actually absorb the lipids that's present in the superficial tissues, and over a period of time, which is followed with medicated steam or perspiration, induced perspiration with medicated herbs, it will dilute, and the internal medications to throw out these things actually brings out. And now it is highly beneficial for the people who are having diabetes and obesity. There is evidence of these things, which is very clearly published and recorded. So there is very systematic research work that is happening under the guidance of Ministry of Ayush. All these are indexed journal publications which have shown that there is a very good reduction in the levels of various factors which is influencing metabolic syndrome. Now comes, when you hear about Panchakarma, always you think about oil massage, but that's just one simple step of it. There is steam, there is massage, there is many processes that is happening, more than 80 to 90, which all are done in All India Institute of Ayurveda. So now when you do an abhyanga or an oil massage, it mobilizes the accumulated fat, specially designed Panchakarma procedures one by one are adopted, which actually mobilizes. Now there will be a concept. You are actually trying to take out a lipid. Then how can you use a lipid again to take it out? It's same as like washing a cloth. We use the detergent, which is similar to the condition of the dirt in it, and it can dilate it. It can make it more easy to bring it out when it's being washed away. So even these have significant results on the hemodynamic effects. And also, Ayurveda is so customized that you can even customize the oil and the ingredients of the oil which is being used to actually massage, so that every oil, for example, Chandana Taila or an oil from sandalwood is cold in potency, but when something is from a sesame oil or a olive, it's hot in potency. Both of them have different actions on the body when it's being massaged. So season-wise, person-wise, condition-wise, it's all chosen. So there are specific things which can be adopted, which will actually cause a complete liquefaction or a dilution of the accumulated fat or lipids inside the body, and it can actually bring out the preconditions of metabolic syndrome. There are certain therapies like medicated, fermented, herbal bath. There are a group of herbs which are being fermented in a natural process, and this fermented liquid is poured over the body to create a kind of roughness, a kind of dryness. The external body started drying up, and that naturally dries up the internal core, including the channels, opening up the circulation and the entire system actually that is corrupt inside, along with the medications that we take. Even that has proof and evidence, which is also evidenced. So one of the major things that is being done in Ayurveda is called as Enema or Therapeutic Basti. In that, we have a group of Basti which are specifically meant to reduce the extra lipid content in the body, the extra what you call accumulations in the body. That's called as Lekhana Basti, Vaitarana Basti. There are many Bastis which we call as Therapeutic Enema, which are very precisely customized and wonderfully prepared to execute this process of elimination from the body, detoxification or cleansing from the body. These are the evidences that very clearly states about the reduction of lipids and the entire metabolic syndrome symptoms when you actually undergo these therapies. These are all published articles. And there are also major invasive therapies like Vamana and Virechana, which are the core part of Panchakarma, which we call as Shodhana. Even though it is contraindicated in chronic conditions of heart disease and very less patient strength, they actually clear the complete channels of the body, and they do a complete channel cleansing and blockage removal. And you believe it or not, every one of us, including all the Ayurveda doctors you're seeing right now on the screen, we does it ourselves because we know the benefit of that. And there are more than enough evidence which clearly states the improvement in appetite, bowel habits, lipid profile, improvement in Virechana Karma over fructose-induced metabolic syndrome in an experimental study. So there is reduction of LDL, VLDL level. So there are wonderful evidences which are generated with this Vamana and Virechana. Vamana is therapeutic vomiting, wherein you are actually inducing vomiting to a person after a systematic planning and processing of purification of the body, wherein the patient has to stay back to undergo the entire thing under the observation of a physician. Virechana is also not just giving a purgative drug and asking you to get back. It is all about having a systematic plan of lipid intake, diet management, rest, massage steam, followed with the purgative medication on the 7th or 10th day based on the kind of lipid that you've intaken. It's a very systematic process. These purification processes are also seen to be very beneficial in reducing the symptoms of our metabolic syndrome. When it comes to Shirodhara, very popular and very relaxing and very a soothing therapy, what you can call. It is one of the most effective line of treatment which is already proven for hypertension, stress, and insomnia. Who doesn't have it today? So everybody who is seeing this image, I wish that you make Ayurveda one of the official medicines of Canada, and please start these therapies as soon as possible because it's very alarming over there. Shirodhara also have all these proof or evidences which tells that it is really beneficial in reducing the symptoms of all the metabolic syndromes. When it comes to another part which is called as Raktamokshana or Jalokavacharana or therapeutic bloodletting, because we use a kind of leech or medicinal leech which is called as Hirudo medicinalis. Even blood channels are purified using these leeches. So this is very popular in Russia and various other parts of the globe. So it is once again told 5,000 years back in Ayurveda that on a seasonal basis, and this is being done, this also really help in improving the circulation, because this Hirudo medicinalis saliva itself contains around 13 different chemical composition that actually acts as natural anticoagulants and can open up channels which can actually help in. If you actually look through this, you can see that they are actually helpful in antithrombin, antiplatelet factor, XA inhibitors, antibacterial. So it has many properties which is really beneficial and which is really helpful even in this condition. So when you come to palliative care as such, I have completed first one as the Nidana Parivarjana or avoiding root causes, second one the Panchakarma, a brief overview, and the third one coming to the most important part, the palliative, or trying to sustain things in a normal way. We actually approach the body in two different principles. One is Deepana, another is Pachana. Both are aimed at Agni or the digestive capacity. So Deepana is those herbs, the use of combination or single herbs, which helps in stimulation of appetite, hunger, and all factors that involve in food intake. Anorexia is a different condition. Indigestion is a different condition. So Deepana drugs are the drugs what we use to treat the anorexia or the kind of intake of food which is required, the hunger, the appetite, which is also influenced by the mind. So the importance of diet, lifestyle and the sattva or the mind is as equal as what it is with the medicines. When it comes to pachana, it is those herbs or single herbs which are compound medicines which are helpful in the process of assimilation. Because many people have no problem in taking food, but they don't get it digested. These are two different steps. Both are which related with the Agni. When it is transformed, that is when it gets assimilated rightly into the body. So I have given a list of commonly used single drugs in the lower level and also compound drugs in the upper level. So these are very commonly used to actually control this. And even the Agni is also having a very important role from converting the nutrients into a bioavailable material inside the body, which actually goes into the proper assimilation inside the body. So we should correct things from the root. Now coming to the most important part, the cleansing drugs, which are very popular all across the globe today. If you look at this already, Dr. Pramod and my seniors have told about these. Guduchi. After COVID, this was one of the most popular drugs across the globe, Tinospora cordifolia. It's one of the wonder drug which can actually help in improving the immunity at the same time, clean these channels and acts as a very good antioxidant also. Haldi already spoken about, Amla already spoken about, Shilajittu or Asphaltum Punjada, one which has already been talked about by Dr. Pramod, and Ashwagandha, very popular one. Indian Ashwagandha is one of the most best kind of ashwagandha which is available across the world, which is really helpful in controlling these things. But it should not be self-medication. It should be always under the guidance of a well-oriented Ayurveda physician. Now coming to the proof of that, we have systematic reviews. We have a lot of evidences which even tells about the effect of these herbs, which were already told by Dr. Pramod. We have the compound formulations as well as single herbs, which is helping in the management. So outcomes from whole systems of medicine, of yoga and Ayurveda, all these things, this holistic approach is actually becoming very, very popular. So the management of this metabolic syndrome is quite easy and very deep rooted in comparison to any system when it comes to this Eastern system of medicine, Ayurveda. So to conclude, without taking much time, I just want to tell that actually what I know from a stat, what I got was Canada is investing around 4.2 billion in the treatment of obesity. And 9 out of the 10 provinces in Canada perform bariatric surgery, and no other healthcare programs are available for the prevention and cure of this. Anti-obesity medication is not available for more than 80% of the population because of the limited access to the private drug benefit plans. So the conclusion and the answer is in the picture: Ayurveda diet, lifestyle, and management to prevent as well as to tackle the problem that is being faced, and introducing Ayurveda to the healthcare system will be one of the best things. As Dr. Pramod has already told, the statistics till 2018, I want to go a step further to tell you the recent statistics, which I just tried to accumulate between the presentation. It is 35,000 patients which we could actually manage from 2016 to 21. I couldn't change the sentence even there. It is 35,010 patients. So it is really overwhelming to look from the eyes of AIA that a diabetic and metabolic OPD in few years is gaining so much popularity and good results. So to conclude, incidence of metabolic syndrome or syndrome X is alarmingly increasing. We need to shift towards an integrated and holistic personal approach. The P4 medicine is really gaining importance now. And every science has its advantage, every science has its disadvantage. Everything should go hand in hand to actually benefit the mankind. And integrated medicine is taking a lead in India now. So Ayurveda and Panchakarma therapies are beneficial for tackling metabolic diseases as a preventive care as well as for management from the root cause. So to conclude as complete, I just want to tell, we are like the same old Intel run Pentium PC processor PC, the same body, the same human being, which lived many years ago. But we are trying to run the latest softwares like Mac OS and your Windows 10. Is it compatible with the same hardware? That is what we need to think. Our lifestyle and our diet has increased into such a high difference that it is really troubling us. So we should really rethink. So thank you very much for any query. Really helpful. This is All India Institute of Ayurveda. You can mail us at director@All India Institute of Ayurveda, IIA. www.india-canada.gov.in. Thank you once again for India-Canada Association and Ministry of Ayush and all my director and seniors for giving this talk. Thank you.
Thank you so very much, Dr. Prashanth. Your images were very, very enticing, and we're looking forward, Center of Excellence coming up in Toronto very soon with the help of UHN. Before I invite, of course, our Dr. Harish Verma, who is one of the very strongest pillar for the concluding, I would like to hear some comments from Dr. Paul O. and then our own Manojji and Tanujaji, and then I'll invite Harishji for the concluding remark. So Dr. O, any quick feedback on the session today and the way forward?
Thank you, Satish. That was a very exciting presentation. It was wonderful to hear from Dr. Prashanth and Dr. Pramod. Learned a great deal. And again, I think that there are some very interesting parallels when we, and it would be great to go into detail about the complementary approaches, what's in a dietary plan, for instance. What do we understand about nutrients? The level of understanding and detail from our colleagues is quite remarkable. I'm intrigued by research that has been published that Dr. Prashanth unfortunately didn't have enough time to go into in detail. So that would be a wonderful other conversation. But I think, as we've been alluding to over time, that there are some great opportunities here. We look forward to working with Dr. Verma locally to help define an agenda, since you've been thinking about the Canadian environment far more than any of us. So I think that there are some great tangible steps for us to move forward together.
Thank you so very much. And Dr. Tanuja, your comments, please.
Yeah, thank you. And I really appreciate even Dr. Nilofer and Dr. Paul. And I think our presentation from wonderful presentation from Dr. Prashanth and Pramod. I think all four presentations complement each other, because our thought process is the same, the approach and the presentation is little different. But at the end of the day, I think it's the integrated and holistic approach. And as you mentioned, Dr. Paul, it's very important to develop the customized practices which suits to the culture of the local native from the Canada, so that it may not be the Mediterranean diet, it may not be, but it's something which is really, because we say that the pathya is the one which should be derived from the food habits of the individual person. So which it suits to the best, and then we have to just find out which is beneficial and which is good and which is bad. The second very important aspect of all these presentations, what we say that it is the Pramod mentioned about the ingredients, Prashanth mentioned about the procedures, but the Ayurveda also gives the importance to the matra, that is quantity. So the ingredients, the wholesome, the menu, the recipe, and how it should be, what you mentioned, Nilofer, about the portion size. So that's also very important. 6 taste, 4 form. The 6 taste, 4 form, and the portion is very, very important. Matra, quantity is also very important. More important is the timing, because when we eat, what are the gaps between the 2 meals? So that it is a kala bhoji jitendriya, that is hitashi syat, mitashi syat. Kala bhoji jitendriya. So the timing is also very important. So in a very short span, we could not highlight each and every aspect, but I'm really very, very thankful. And I think our objective is achieved to sensitize about this is just primer about both the systems, what exactly is available. And then the second presentation, the second workshop may be how we integrate. And the third would be how we develop a customized capsule which is suitable to the Canada. I think that is a very good step. So I congratulate Dr. Satish Thakkar, Harish Verma and the entire team for bringing both East and West together. And we look forward to have many more meaningful collaborations, Dr. Paul and everyone. Thank you.
Thank you, Dr. Tanuja ji. And I'm not a doctor. I'm in the August company of doctors, so I'm getting that all vibes of being a doctor. But our Manoj Nisariji, before we conclude, would like to hear some of your comments as well. Dr. Manojji.
Yes, Satishji. Yeah, sorry for a little interruption. I'm really happy that this discussion went very well. Dr. Paul, he actually highlighted the essential parts of the metabolic syndrome. And then Nilofer, she explained the dietetics, the Mediterranean diet, and how the various diets, they can be actually customized according to the community, because the diet and nutrition, so these are very sensitive to the culture, very sensitive to the region, very sensitive to the various communities across the world, and how actually you can customize it. So that is very essential, and good that Prashanth and Pramod, they focused on the Ayurveda part of it. There is a lot many things further to actually explain and further to discuss. There could be gray areas on both the sides, whether it is from the Western medicine, there could be the little understanding of Ayurveda. We are conducting a lot of research on Ayurveda. So for example, now the All India Institute of Ayurveda and the Institute of Liver and Biliary Diseases, ILNBS, so they have collaborated, and now they are working on the various aspects of the diet, as well as the biocleansing procedures on the gut microbiota, that how actually it affects the gut microbiota. And we know quite a lot about the gut microbiota, how actually it affects the overall health. So that is on one part. At the same time, a lot of studies are going on the genomics part of it, that how they diet and the other various procedures, they work on the genomics. So even on this biomedical field also, this lot of research is going with the institutes which are there in India as well as in abroad. So with this perspective, I would suggest that maybe we can have one more brainstorming in between the two institutes to develop the protocol for the obesity for external therapies. Because what actually Prashanth mentioned, that there are numerous external therapies. We understand that there are regulatory provisions which could be there, there could be some difficulties from the regulatory point of view in Canada for giving the internal medications and giving this the MSAs or purgation. So, but the external therapies could be little easy. So maybe actually we can focus on this particular aspect, the simple obesity, no complicated patients, and how actually we can control the obesity with the simple external therapies. So maybe this project actually we can take, and within short time we can come out with the results. Actually, you can measure on various part of the body that what was the measurement before treatment and what is the measurement out after treatment, and that is quick results that we can get. So maybe actually we can work on this. I'm sure that there are many viewers, they have joined on this platform either through YouTube or the Facebook and the other multimedia. And I'm sure that they must have been actually enlightened about the various aspects of Ayurveda. There are a lot many things further to elaborate, but I'm sure that this must have been sensitized to them. And we are open for any kind of further queries or discussion. May not be today, but maybe in future also. And the All India Institute of Ayurveda, the platform is already there, or you can write to me as well to the Ministry of Ayush for any kind of support for the further collaboration. So this from my side. Only we have actually overshooted the time we actually set, but I think that we had a really good brainstorming. So thanks to all of you.
Thank you. Thank you so very much, Dr. Nisariji. And you rightly said it, and will request soon to export to Dr. Prashanth or equal of him for all these external therapies in Toronto soon. So, Nilofer, you have any comments before we?
I just wanted to say thank you. I've learned so much today. And I hope to continue to learn and collaborate if that's a possibility. And yeah, it was a wonderful session. Thank you for inviting me.
Thank you for joining. And
Satish,
Dr. Harish Verma, he's
Satishji,
yeah.
I would just like to answer one question over here. Sorry for the interruption. One question here I see from Surya Narayan Patnaik, Anchala. Is there any approach in diabetic ophthalmic diseases? There is a lot of treatment is available in Ayurveda, and there are some center of excellences which are supported by the Minister of Ayush exclusively on the Ayurvedic ophthalmology. And there, the patients with the lot of the diabetic retinopathy and others, they are treated as a similar patient. They are treated in All India Institute of Ayurveda as well. So definitely there is a lot of treatment, and those who are willing to take the benefit of it, please contact the All India Institute of Ayurveda. So thank you. Sorry, and actually I interrupted in between.
Oh, thank you, Dr. Nisari. And Dr. Harish Verma, who is one of our very strong pillar, part of it's a collective initiative. I would request him to do the concluding remark and also the vote of thanks. And Dr. Verma, I think there is another question also there, that how to manage insulin dependence in geriatrics. So maybe you want to address that as well in your concluding remarks. Yeah, over to you.
Okay, thank you, CG. And it was a wonderful session and a lot of information. I have to digest many things, but I want to highlight one point. In Ayurveda, there a lot of emphasis has been made on purification or detoxification therapy. In my practice, I use laxatives. It's called Virachan Karma in Ayurveda. It's one of the Panch Karma therapy. It's a use of laxatives, and the results are amazing. So I will request Dr. Paul to think of if weekly laxatives can be added in the management of metabolic syndrome, along with other medications like anti-diabetic, anti-hypertensive, lipid-lowering drugs, weight management drugs. If the laxative, because the concept of laxatives is very, very unique in Ayurveda. If we can clean the stomach, clean the intestines, clean the colon, that's a wonderful idea. It is right at present. It has not been incorporated in the management of metabolic syndrome in allopathic science. If the research can be done, how the laxatives can help the people suffering from metabolic syndrome, the regular laxatives, of course, we can understand there may be some side effects of use of regular laxatives, like there may be potassium depletion, sodium depletion that can be added later on. But I have seen all the parameters like blood sugar, blood pressure, cholesterol, they all reduce with the use of laxative, particularly Trifla, as all the speakers have emphasized on Virachan Karma, on use of laxative. I fully appreciate. So this is the point which can be incorporated in the modern management of metabolic syndrome. And regarding the question of this insulin, of course, it's a wide subject, and we will answer it, Satishji, through email, how the insulin dependent or insulin, I couldn't read the question. We will answer it separately. And it was a wonderful session. I congratulate Ayush, I congratulate CIF, and I congratulate UHN. It was a wonderful session, and it was a wonderful information. Thank you, sir.
Thank you so very much. And at the end, I request all the participation for your patience and staying till the end. Please do spread the message, awareness, and our purpose is to create an ecosystem where we can do more work on this integration. Once again, thank you UHN, thank you Ministry of Ayush, thank you All India Institute of Ayurveda, Consul General of India in Toronto, and on behalf of Canada India Foundation, Vedic Spiritual Heritage Foundation, and All India and Canadian Ayurvedic Practitioner Association. We thank you all and enjoy the rest of the weekend. Thank you. Namaskar.